Hi, Ryan Young. My name is Paige, and I'm going to be doing a health history assessment on you and current about your current health status too. Okay, just asking you some questions.
Sounds like a plan.
Okay. You mind telling me your date of birth?
7/31/83.
Okay. How would you say your current health history is? Your current health status is?
I think it's good.
Your current health status is good.
I think I'm doing okay.
Um, Anything you want to tell me about? Any
Um,
complaints? Any
I got a bad foot.
bad foot? Okay.
My foot hurts.
Um, what medical issues have you had in the past?
I had a mole removed from my back,
Okay. You know what year?
1999.
Okay. Did they biopsy and everything? Did they find anything about it?
Everything negative.
Negative, so no skin cancer or nothing.
All good.
Okay. What does your current diet consist of?
A lot of meat and vegetables, and pretty good diet. Some carbs.
Okay.
I like coffee.
How many things of coffee do you drink every day? Cups of coffee.
Probably two or three.
Are you on any current medications?
No,
You don't take anything currently?
no. Except ibuprofen for my foot.
Okay.
But
How
no
many,
prescription.
how many times a day do you take that?
Once.
Just once a day? Have you had the foot looked at?
Yes.
Have they said anything about the foot? What's going on with the foot?
I've been referred to a podiatrist.
Um, so, any other surgeries besides the mole removal?
Nope.
Okay. Uh, what do you do for work?
I'm in construction.
Okay. Any hobbies, physical in nature, or
Sure, I like to exercise and I like to play golf
how many times a week do you exercise or golf?
3 times a week, 4 times a week, something like that.
For exercise?
Yes,
How for how long when you're in there?
maybe 2 hours.
How many times do you golf?
Every now and again.
Okay. How is your sleep?
Like a rock.
You sleep like a rock.
Like a rock.
No, getting up in the middle of the night, tossing and turning.
Maybe to pee. I'm getting older.
Okay.
Sometimes I have to pee.
How long do you sleep at night?
As long as possible. Maybe 7, 8 hours. I'd like more, but the alarm goes off.
Okay. And when you wake up, you feel rested and everything?
Sometimes I dream a lot, so maybe I toss and turn a bit, but I don't really get up. But sometimes.
Good. What does your social life consist of?
It's I have a lot of friends and family and active all the time. And have a great social life.
Okay.
Yeah.
How is you and your family's financial situation?
Good. Good money. The money's good.
Okay. You think you're pretty stable?
Very stable.
Very stable.
Very stable.
No concerns or stress about money?
No stress whatsoever about money.
Okay. What cultural traditions do you participate in?
I go to church.
Okay.
And Thanksgiving and Christmas. The usual holidays and stuff. American culture.
American culture. Any like diets or anything culturally that you do, or any rituals or routines that could interact with any type of medical treatments or anything?
I can eat anything. I don't
Okay.
nothing like that.
Nothing, no restrictions.
No restrictions.
So you would call yourself American culture?
It sounds right.
Okay. What spiritual practices do you believe in and participate in?
Christian.
Christian. Okay. How is your environmental situation? Air, water, pollution,
I don't know. I'm not too privy to it. Everything seems fine.
environment seems fine.
Yeah, it seems pretty good.
No concerns about getting food or water or
None.
how far along in your education did you get?
I've got a GED. And that's it.
That's it. Okay. Do you feel safe at home?
I do. I do. There was a time that I didn't,
Do you, care,
but I do now.
do you care to elaborate?
No,
You don't want to elaborate why you didn't feel safe at home.
no, that's my business.
Okay. Okay. But you feel safe.
That's
going
something I
there
keep very close to the chest.
now. Okay. But you feel safe now.
I feel pretty good now.
Good. All right. Now we're just going to review some of your like your physical systems about yourself. Okay. Like past stuff and current.
Bring it on.
Is that okay? All right. First, we'll talk about your skin. How's your skin? Any rashes, itching, any breaks in your skin? Any concerns with your skin?
No, no, I think the skin's fine.
The skin's fine.
I work outside, so I get really a lot of tan. So I worry that later I might have skin problems, but I don't have any skin problems yet.
A lot of sun.
A lot of sun.
And are you wearing sunblock and everything, and head coverings and?
Sometimes.
Okay. What about the foot with the skin? How's that?
The foot is okay. It's back and forth. It hurts sometimes.
But the skin's intact there.
Most of it.
Okay. Okay. Now let's talk about.
Excuse me for a minute. All right, go for it.
Let's talk about your head. Have you had any head injuries or headaches or
No.
no concerns? Okay. About eyes, any eye surgeries? Do you wear glasses? Do you have any eye pain?
No.
Okay. Ears, any hearing problems, pain, ringing in your ears?
None.
Okay. Nose and sinuses, any bleeding, frequent coughs or sinus troubles?
I get stopped up every once in a while. I get a sinus headache and sinus infection sometimes.
Okay.
Rarely.
What do you take for that when they happen? Is
Like sinus, over the counter sinus
Just-
medication.
any allergies,
Penicillin.
asthma, hives,
No.
an allergy to penicillin?
Yep.
Is that the only allergy you have?
Only one I know of.
Okay. Mouth and throat, any problems with your tongue or your throat? Sore? Do your gums bleed?
Maybe a little gum bleeding sometimes when I brush my teeth.
Do you see a dentist regularly?
I just started going back to the dentist. I hadn't been in a while.
You went and saw him and talked to him about your gums bleeding, or
They said everything was good. They said everything looked great.
good? Any problems with your neck, stiffness, any lumps in your neck?
I have a lump in my neck. It's like a lymph node. I've had it for 20 years.
Okay.
And there's neck stiffness.
Neck stiffness. Do you see anybody for your neck?
No.
Are you gonna consult somebody about your neck?
Maybe sometime.
They don't give you much problems.
It's been stiff for so long that I forgot it was a problem until you mentioned it.
Okay. Any in your chest area, your breast? Do you have any problems with them?
Yeah, chest is good. No breast.
No lumps or pain or soreness.
No, I'm good.
Your breathing. Are you ever short of breath? Cough, wheezy?
Rarely. I have a little. I do some breathing techniques and exercises. I have shallow breath sometimes, but they say that's for anxiety. I have breathing techniques that I use.
Do you see anybody for your anxiety, or do you take anything for your anxiety?
I used to. I don't anymore. I used other methods than medicine to relieve my anxiety.
Okay. Like,
Breathing techniques, exercise, just different lines of thinking.
good. Okay, any problems with your heart? Do you have any chest pains? Any history of heart problems? Do you take anything for your heart?
None, nothing. All good so far.
Now your gastrointestinal. Do you have any weight changes? Any changes in your appetite, nausea and vomiting?
I shift weight a bit, but I probably go up and down 10, 15 pounds every so often.
And what's that from?
Just gaining weight and then trying to lose it.
Okay. So you have control of your weight gain and loss. Like it's not like something that
Pretty good. Yeah.
comes up like, oh, all of a sudden I lost 10 pounds or gained 10
No,
pounds.
no, I'm in control of.
You know what's going on.
Yeah, I understand why. It's eating and then not as much eating.
Okay. Now your urinary tract. Do you have any problems with your bladder or urinating or anything? Any pain?
Sometimes I pee a lot. Sometimes there's a little pain.
Sometimes pain.
A little bit.
Do you see anybody for that?
No.
Does it resolve on its own? Do you take
Yeah.
anything?
Usually it resolves on its own.
Now with your legs or anything, with your circulation, do you have any peripheral vascular things? Do you have any leg cramps or varicose veins?
No.
Okay. Now your musculoskeletal system. Do you have any pain, swelling, stiffness, like in your
No.
muscles or anything?
No, no.
Okay. No swelling, no stiffness, no pain nowhere.
Nope.
Good. Neurologic. I know we talked about this earlier. Headaches, but did you have any seizures, weakness, paralysis, loss of muscle control, numbness, coordination?
No.
As far as like blood work and any blood problems you've had in the past or any past transfusions, anemia, easy bruising.
No problem.
Endocrine. Yeah, this is about your glands and your hormones and stuff like that. Have you had any abnormal growth, increased thirst?
I get a little thirsty sometimes, but I don't think it's anything to get worried about.
You don't think it's excessive?
I don't worry about it. No.
Increased appetite?
Yeah, sometimes. Absolutely.
More than normal, or
I get pretty hungry.
you just get hungry and then you eat and you're
I eat a lot.
full?
I eat a lot. No, I can't. I have trouble getting full sometimes.
Trouble getting full. Do you feel after you eat? Do you feel satisfied, or you still feel hungry?
It depends on what I eat. If I eat a lot of like carbs and stuff like that, I can usually get full. But if it's a lot of meat and vegetables, it takes a lot of meat and vegetables to get me full.
Okay. Do you have any increased urinating?
Yeah, sometimes.
Sometimes. Sweating and increased sweating.
A little bit of sweating sometimes, yeah. Sometimes sweating.
When does the sweating occur?
You get the night sweats.
Night sweats? Do you have diabetes?
Not that I know of.
Not that you know of. Family history of diabetes?
Yes.
Who was that?
Mother and grandfather.
Okay. Have you been tested?
No.
Okay. Do you have anything lined up to get tested?
Yes.
Okay. As far as your mental health, tension, anxiety, depression.
All of them, but working on all of them.
Do you see anybody for it?
No. I have, but I don't anymore.
Do you want to?
No.
Do you take anything for it?
No.
Do you have any memory problems?
Yes.
Do you know what you think? What do you think it's from, or what causes it?
I do not.
Sleep problems. You said you didn't have.
Not really.
Okay. Past history of psychiatric or a psychiatrist.
Yes.
What did that consist of?
What were the diagnoses?
Yeah, like what's your history with that?
Bipolar, anxiety, depression. Psychosis, mania.
Did you seek help for that at one point?
Yes.
I mean, did it help, or
Some.
it helped? Did you see somebody outpatient or inpatient?
Both.
And you don't want to see anybody anymore?
No. I find that you can help yourself a bit, so I tend to help myself.
Okay. Do you have any changes in mood?
Yes.
Okay. I think that's all I have to ask you, Ryan. Thanks for your time. Did you have anything you wanted to ask me?
No, I appreciate it. I think you covered everything. I thank you.
Thank you. And we'll get back to you and follow up and see what we're going to do. See what kind of help you want or kind of concerns we can look into.
Sounds great.
Good. Thanks for your time.